Good afternoon, everyone. Before I begin to talk about the case numbers today, on behalf of all Nova Scotians, I want to extend sincere condolences to the family of former Premier Donald Cameron. He represented the people of Pictou East for nearly 2 decades and served as Nova Scotia's 22nd Premier. Our thoughts and prayers are with his family and friends. Turning to COVID, we are reporting 146 cases today, most in HRM. This after a weekend of the highest cases this province has ever seen. And to make matters even more worrisome, we now have 42 people in the hospital and 8 now in the ICU. That number has increased even since we had the release go out this morning. We wanted to give you a picture of how much that's increasing. The average age of people in the hospital is between 40 and 60, but we are admitting younger, more healthier people, and they're coming in sicker. And that's because of the variants. They're more aggressive, they move faster, attack, and make you sicker. And yet, there are people that are still not listening. I spoke with the Chief of Police for Halifax and Cape Breton Regional Municipality today, and they are as frustrated as Dr. Strang and I are. Over the weekend, there were 37 fines issued in the Halifax area. That's outrageous. I want to thank everyone for following protocols, but there are still groups of people who aren't. I have a serious question. What is wrong with you? How come you don't take this as serious as you should? I want to paint you a picture. Right now, if you gather, you risk being infected by a variant. Most likely the B117 variant, also known as the UK variant. I'd like to ask a favor of all of you, especially young people. I know you like your phones a lot. I would suggest that you go online and do a little research about what that variant is doing across the province, or send an online message out to your friends' networks that across different parts of the country to get a first-hand look at what the outcomes are in different provinces of what's happening with that variant. That's the variant that you may take home and risk infecting your loved ones with. Then you go to work and you infect your coworkers. What part of that pattern of spread do you not understand? The only answer that I can come up with is that you don't care. We are in the 3rd wave of a deadly pandemic, and the selfish few don't care. Healthcare professionals are working nearly around the clock to keep us safe, and the selfish few don't care. We are creating contingency plans about our hospitals that are being strained. We have shut down our province, impacting the livelihoods of our business operators. Yet the selfish few don't care. We are in a race against the variants to get people vaccinated. We have expanded the age group for AstraZeneca from 40 and up. Today, we've dropped the age requirements to 50 and up for Pfizer and Moderna, and we will open our first drive-through vaccine clinic in Dartmouth next week. We're vaccinating people as quickly as possible, but while we push our immunization program, we need to continue to follow public health protocols, including adhering to the rules of this shutdown. No gatherings, stay close to home, and please stop socializing and partying. Isn't that right, Dr. Strang?
Absolutely, Premier. That's disappointing to hear, but I do know that the majority of Nova Scotians are doing the right thing, but we need everybody to do that. Good afternoon, everyone. We now sit at 943 active cases in our province. There is widespread COVID-19 activity in the Halifax area, and we continue to watch closely for signs of community spread in other parts of the province. I want to thank the public health and lab teams who worked tirelessly over the weekend to clear the backlogs in testing and data entry. Substantive progress was made, and we are seeing that, as we warned, in the case numbers that are being reported. But by tomorrow, the lab should once again be able to meet the 48-hour turnaround time between getting a test and learning your result. Later this week, we should start to see the impact of the province-wide restrictions, and I anticipate case numbers will start to decrease. But this is going to take time. And as the Premier said, our hospitalization rate is rising, and so are the admissions to intensive care. We are seeing previously healthy young and middle-aged adults get COVID and then rapidly deteriorate to severe disease. Whether you're young or old, healthy or not, the virus does not care. And even if you don't get severely ill, it could be the person you pass it to, a friend, a sibling, a parent, a child. While there are treatments that can help with the symptoms caused by COVID, there is no cure and no guarantee. And even if you've had your first dose of COVID-19 vaccine, it takes at least 2 weeks to develop immunity to the virus. There are a couple of people in hospital because they went out to celebrate immediately after getting their first dose of vaccine. You do not get complete long-term immunity until you get your second dose. And that means you still have to follow public health measures closely, even if you've been immunized. We also learned that over the weekend there were a number of positive cases that, when first contacted by public health, needed an immediate call for an ambulance. In some cases, people did not call 911 because they were unable to pay the ambulance fee. And we worked quickly on Saturday with EHS to waive the fee for anyone with COVID who needs emergency transport to hospital. And I need to remind everyone that if you have COVID and your symptoms are getting worse, immediately call 811 or, if needed, 911. Do not call public health and do not wait for a call back. We've had a number of cases where people have had initial contact from public health and then they get a lot sicker and they're phoning and leaving a message for public health. If you're concerned about immediate health issues, 811 or 911 is your phone call. And now I'd like to clarify a few things around testing and gatherings. If you feel unwell or have symptoms, even one, isolate immediately and then go online and book a test at a primary assessment center. You can also book a test if you've been told by public health that you are a close contact of a case, you have been at an exposure site, or if you've traveled for any reason outside of Nova Scotia, Newfoundland, or PEI, whether you're a student, rotational worker, or exempt traveler and need testing. Now that the backlog has been mostly addressed at the lab, we are opening up some booked appointments at assessment centers in Central Zone for people who have no symptoms or are not in one of the above listed groups. But you can also get asymptomatic testing at a pop-up site. And because of the wide circulation of the virus in the Halifax area, it's important that everyone who lives in this greater Halifax area continue to get tested regularly. Anybody who's out and about in the public, even if they're going, as we're allowed to, go for essential groceries, things like that, even necessarily having to go to work, you're quite possibly may have been exposed. We're hearing stories, people are saying that they're only relying on the exposure notifications, and that's not sufficient here in Halifax. So anybody who is out in the community in any way needs to continue to do regular asymptomatic testing, because everyone should assume that they have been exposed to the virus. Getting a test is easy and free, and while you may have a bit of a wait, you will be making an important contribution to keeping yourself and others safe. The final thing I want to address today is how people can get together while these restrictions are in place. Most importantly, I want to clarify that there is no gathering limit. It's not 5 people, it's not 10 people. If you're not with your household, the gathering limit is 0. You can gather indoors and outdoors in close contact and without masks with the people you live with. And if you're a smaller household of 2 or less people, you can choose 1 or 2 others to do this with, but they must be the same people all the time. Those are the only ways that you can gather in close contact with other people. You can also get together informally with someone from another household as long as you are outside and at least 6 feet apart. Meet up with a neighbor for a walk or a bike ride. Sit on opposite ends of your deck or driveway, but do this in pairs or very small groups. This is not permission to gather in larger groups with multiple people or for households for things like backyard fires or barbecues. You can also do outdoor activities hosted by a sport and recreation group or facility as long as there are no more than 5 people and you stay at least 6 feet apart. And examples of this would be indoor fitness classes, a game of golf, or a dog training class. The point of these restrictions is to take away opportunities for this virus to spread, which is when people are in close contact in groups and indoors. And we also have no formal gatherings by a recognized business organization at all at this time in the province. And I will stress again today how serious this situation is. We are not anywhere close to being out of the woods. These measures are absolutely necessary to get us to the other side of this outbreak with as little impact as possible on the health and safety of Nova Scotians. This virus can be deadly. It's not like COVID from a year ago. It's almost a new virus. It's COVID 2021. Following the restrictions will save lives in your community and will protect healthcare and other essential workers who are putting their health at risk for you. There are 42 Nova Scotians in hospital fighting this virus right now. They deserve our support, our prayers, and our commitment. Let our actions speak louder than our words. Stay close to home, Nova Scotians. Stay within your household. Get tested and get your vaccine when it's your turn.
Thank you, Dr. Strang. We'll now take one question and one follow-up in the time we have for today, beginning with CBC's Jean Laroche.
Good afternoon, Dr. Strang. You have said for months now that age-based vaccine rollout is the best strategy based, obviously, in part on our low infection rates, or what were our low infection rates. Now that we have a serious outbreak in the Halifax area, should that strategy not change to protect the most vulnerable, those most at risk, to protect them, their families, and the healthcare system?
So we have to separate what works to deal with an immediate outbreak. Vaccines are not what you use to control an immediate outbreak. You use all the other public health restrictions. Even somebody who's vaccinated today takes at least 2 weeks for them to develop immunity. What we need to do to complement the restrictions that are controlling the immediate outbreak is to build the level of immunity in our population as quickly as possible. And that we've shown that our age-based approach is that rapid process. We are on target now. We've opened up to the mRNA vaccines to those 50 to 54 today. Within a week, we'll be into the 40s. By middle of June, every adult who's eligible for vaccine will have an opportunity to start to book their appointment. That's only about 6 weeks away. All these other groups, to switch our vaccine program now, what people don't understand is the logistics behind the scene, what it would take to identify whatever risk group you're talking about, get them into the online registration, change our vaccine process. All of that takes time, and what that would do is slow us down and slow down the development of our population immunity, which is our key target. We need to build population immunity as fast as possible. So we need to stick with that age-based approach. It's 6 weeks before every Nova Scotian who's eligible will be able to get a chance to book their vaccine. Any other approach pushes that target out substantially.
Go ahead with your follow-up, Jean.
On another topic, you talked about workplace outbreaks on Friday. Is there more that the province can do to get employees to send their employees home where they'll be safer and less at risk? And I guess this question could extend to the Premier, since that might be a legislative change.
So I'll start. We flagged that. My colleagues in the Department of Labor are looking at this, and certainly we've increased the messaging that's going out to employer groups across the province, and the critical need for them to allow people to work from home, if at all possible. If that's not working, then we can go further than that. But our first step is to work collaboratively with all these employer groups, and I have to say that by and large, throughout the whole pandemic, they've all been engaged very positively. So we believe we will get the outcome that we need through the positive collaborative approach.
Question will go to Heidi Patrick with CTV.
Hello, Heidi Petrachik here. I guess this would be a question in terms of the third wave and vaccinations. You mentioned that really vaccination isn't the way to deal with the third wave, but I guess I'm trying to figure out if the third wave will keep on going until we reach herd immunity, or how exactly does the timing of that work? Like in 6 weeks, what can we expect will happen?
No, the vaccination is critically important. What I was saying is that when you have a large outbreak, the immediate response, the vaccine is not the tool in the short term to try to get things under control. You need public health restrictions to break cycles of transmission. You also need to layer on the building of population immunity through vaccination as part of the longer-term solution. So the two need to happen together.
Go ahead with your follow-up, Heidi.
Thank you. Yes, and on Friday there seemed to be some confusion about the availability of AstraZeneca in Cumberland North. I'm just wondering, it seems like residents there cannot book for AstraZeneca for the 40 and up age range, that it's not available there. Can you clarify if that is the case, and if so, why?
So I want to be clear. We've had in total 60,000 doses of AstraZeneca vaccine that came in 3 different batches. That's all. That was distributed equitably across the province. It just so happens that Amherst got the first allotment of vaccine when that came in March. The residents of Amherst have had equal opportunity to get AstraZeneca vaccine as any other Nova Scotian community. There's only been a small amount that we've had to distribute. All the other vaccines, there is good access to the mRNA, Moderna, Pfizer vaccines in Amherst like there is in every community across the province.
Next question will go to Elizabeth McSheffrey with Global.
Thank you. I guess this question would be for either the Premier or Dr. Strang regarding enforcement. Are you able to provide even just a general, broad sense of how much spread is connected to the events that we're seeing ticketed for violations of public health orders versus general community spread that's not connected to rule breaking?
So I don't think we have we don't have that detailed breakdown. That would be very hard to tease out from the public health follow-up. But if we do know that what we're seeing right now is a result of things from a week or 2 weeks ago. So if people are concerned about non-compliance over the weekend, that would be too early to have caused direct transmission. What I can say in general, though, is that we have the restrictions and the rules and the fines in there for a purpose. And people who aren't following that are clearly going to be putting themselves and other people at greater risk from this disease. We don't put things in place just because we want to. We put them in place because they're necessary, and we have fines because for some people it seems to take they need to be told what to do and have a penalty. Fortunately, that's the minority.
Go ahead with your follow-up, Elizabeth.
Thanks. And Dr. Strang, I think a lot of Nova Scotians are pinning their hopes on herd immunity eventually kicking in, so there can be some kind of summer, some kind of fall. Is it even possible to discern when we might start seeing the effects of herd immunity? Would that be in the summer or sometime in the fall?
Well, so if we get, so far as we presented on Friday, the age groups we've offered vaccine to for a period of time now are getting very good uptake, 80% or more of the 65 plus. We need to continue that as we offer vaccine to younger age groups, and as I said, by middle of June, we'll be opening up appointments for people who are in the 20-year-olds and the 19 and 18-year-olds. We need those groups to continue to have the same uptake of vaccine as older Nova Scotians are. Once we get there, so it'll be the end of June by the time everybody's had their first dose of vaccine. If you'd say, well, it's 2 weeks after you get vaccine before you get immunity, so it's into June when we'll have large proportions of the population immunized, is my hope. So far, Nova Scotians are stepping up and getting vaccinated, but it will take into that June before we get that population immunity, which is the longer-term tool for keeping. Once we bring the virus under control with our other public health measures, it's the vaccine and the population immunity which then keeps it under control, which then puts us in a position to have a much less restrictive summer. But again, ultimately, this is about the choices that each of us makes. Are we going to follow the requirements right now? And then also, are we going to go get a vaccine?
Next question will go to Kathleen Jones with All Nova Scotia.
Thank you. Premier, you previously mentioned on Friday that support for businesses would be in place by today, but so far we haven't heard anything, and businesses are saying they're struggling. Why hasn't the government yet implemented these supports?
Yeah, I didn't commit to today. I said I was pushing as hard as I can to get it out this week, and so that's still the plan. And my Minister of Inclusive Economic Growth will be launching the program's details tomorrow. So you'll see how we'll be able to get some of the businesses that did have the access to the grant, Small Business Impact Grant previously. We'll have a streamlined way of getting that support. And then we'll have to do some work to contact the new businesses. And then there's some catch-up work with the real property tax rebate program as well. So we're pushing as hard as we can. But getting something like this in order is not like flicking a switch. I can assure you we're working hard to get the supports out.
Go ahead with your follow-up, Kathleen.
Yes, we're also hearing from companies right now, Premier, that have offered to help clear the testing backlog, but they haven't heard back. So I'm wondering if you're looking at third-party or private sector help to assist with this issue.
So I can speak to that. We've had a number of offers of even from Dalhousie Research with equipment, but it's the actual equipment that runs the test is not what's causing the backlog. It's the processing of the specimens and getting them set up to run the test, and there's a number of technical steps in there, which is the backlog. So even though we appreciate those offers of help, what's being offered is not actually the issue which created the backlog in the first place. And the lab has worked, I'm going to call it miracles over the weekend, the folks in the lab and the many people that have worked tirelessly to clear the backlog. We'll have it cleared by the end of the day. So we appreciate the help, but we've been able to deal with the issue with the heroic efforts of the people at the QE2 lab.
And I'll just add to that, and of course thanks to the team for working all over the weekend, but one of our members of our teams has commented that we've done more tests in April than we did in the 9 months of the pandemic combined. So that significant testing, that's what Dr. Strang and I asked for, and that's what came in. So we're working overtime, but that's a significant amount of testing that we're looking at.
Next question will go to John McPhee with the Herald.
Thank you. This is either for the Premier or Dr. Strang, and it's about the ongoing concerns from public transit unions about the COVID risk faced by bus drivers in Halifax. There have been no safety changes since the outbreak, since the rising cases this month, like there were last year, such as boarding through the back door and spacing between seats. Are there any plans to address these concerns?
So, first of all, I want to acknowledge and appreciate the work of our transit drivers. For many people in our community, that is essential for them. That bus service is essential, and I very much appreciate those bus drivers being on the front lines like many other essential workers. We have we've given advice from a public health perspective to HRM. Ultimately, those decisions about boarding, etc., that's their decision. We've certainly worked with them last week when we put in other restrictions. We gave them the approval to decrease the load on buses, so no more than 50% capacity. But the details that you're talking about are really in discussion between Metro Transit, HRM, and the union.
Go ahead with your follow-up, John.
Thank you. In the same vein, in terms of the essential workers and their concerns, QP put out a news release this afternoon calling for smaller group sizes in child care centers and larger spaces to enhance social distancing between children. Again, is the province considering following up on those kind of recommendations?
So we've looked at a year ago. When we opened up daycares, we opened them up at 50% capacity. I've had discussions starting on Friday with education and early childhood development. They're working with. They did a scan and looking at. They've contacted so far 2/3 of the licensed daycares in the province, and the vast majority of those daycares are operating at 60% capacity or less. So our target is going to be to keep daycares at about 60% capacity maximum. The small number of daycares that are above capacity, the department is working actively on options of how to decrease the capacity within those daycares.
Next question will go to Keith Gisette with the Canadian Press.
Dr. Strang, I'm wondering how the backlog in the lab has affected contact tracing, if at all. Could you explain how that works, and are there any concerns arising out of that for that reason?
Well, it certainly would slow it down because, of course, we can't start contact tracing on a case until we goes through the lab, is tested, is confirmed positive, and then goes over to public health, and then we start to act on it. So that's the first thing. We've got a delay. So we're getting cases now where people would have been ill for several days, and that's why it's important that people understand once they get a test done, they need to isolate themselves at home, and we appreciate that their patients, it's been a little longer right now, but they need to isolate until they get that test result back. And if it's positive, they need to stay isolated until they hear from public health. Public health's goal is to, once we get a positive test, is to make an initial contact within 24 hours. A few days ago, we had to shift that to 48 hours. But again, thanks to another part of the health system with heroic efforts, they brought that contact time back to 24 hours. So once public health is aware of it, we will initiate the contact tracing within that 24-hour time period.
Go ahead with your follow-up, Keith.
Yeah, this is for the Premier. Premier, you made a fairly strong statement off the top. It's not every day a Premier asks segments of his population what's wrong with you. So I'm wondering what you might do in terms of fines, that kind of thing, if you see this behavior continuing. I know that you increased it to 2,000. Might we go even higher? Or what are you contemplating here?
Well, I'll continue to take advice, of course, on how we can look at our restrictions and compliance. I've spoken with chiefs of police, and at the end of the day, we're not going to find our way out of this situation. I just want to make sure that our population understands the seriousness of this issue, and don't get me wrong, most Nova Scotians do, and attributed to our success is strong cooperation to the restrictions. But there are a select few that just either they don't care or they don't get it. And I would just encourage Nova Scotians to look at what's happening in several provinces right now. And this variant is no joke. It's killing people. It's putting young people in the ICU. Our numbers are starting to grow. I really don't want to get to that point, but I will do whatever I have to do to make sure people listen.
Next question will go to Adrian Blanc with Radio Canada.
Hello, thank you. My first question is for Dr. Strang. How many COVID tests were done at pop-up clinics over the weekend, and what percentage of these tests came back positive?
I don't have. There were several thousands of tests done. I don't have the definitive number. I don't, and there were a handful of positives. I don't have specific answers to your questions.
Go ahead with your follow-up, Adrian.
Premier Rankin, when things reopen, is Nova Scotia considering using some sort of COVID passport to allow people who have been vaccinated to access some public spaces or travel between provinces?
So that's a topic of national conversation, and because of all the cases and the management of COVID in the third wave, it really hasn't been on the agenda with the premiers and prime minister as of late. So it's not a priority at this point, but we can. We're just not at that level of discussion right now. We're just managing the third wave.
Next question will go to Tim Biscay with the Halifax Examiner.
Hi, Dr. Strang. During the first wave, way back in March and April of 2020, you very helpfully provided us some specific numbers about ICU bed capacity. I'm wondering if you have those kind of numbers now. Were some of those beds repurposed during the low point in the summer, and where are we sitting now?
So certainly there was the ability in the summer and the early fall to reopen a lot of the healthcare services that were closed down during the first wave. There's active work. I don't have the details that I'm at a level of where there's lots of other people working out all those details around that, but we're actively closing down lots of less essential healthcare services and have been for a couple of weeks in anticipation of this, and even more work is happening over the weekend and today, knowing the surge that's in front of us, to ensure that we have, to the greatest of our ability, the necessary bed and ICU bed capacity to deal with the surge, and what the modeling would predict is that what we're likely to need.
Go ahead with your follow-up, Tim.
Yes, I think I know the answer to this, but many, and very many people contacted me over the weekend expressing concern about a U.S. CDC report saying that they were uncertain and had no data on vaccination on the interim between the first and second dose being more than 6 weeks, and so the people are quite concerned that the Canadian approach is not based on science. Can you say something to that?
So I would disagree. We have a National Advisory Committee on Immunization who are experts in immunology and vaccinology and epidemiology, have looked at all that evidence and made firm recommendations that that is perfectly safe, that to extend the interval between vaccination out to the 4-month period.
Next question will go to Victoria Walton with the Coast.
Thanks. Dr. Strang, I'm wondering if we've seen any people in this new age group that opened up for the mRNA shots, the 50 to 54-year-olds. Have we seen any indication of people canceling their AstraZeneca shots the same as we did in the older age groups? And are there any AstraZeneca appointments, opening back up now that age group can get their mRNA?
We certainly did see when the 60 to 64-year-olds opened up to mRNA, there was cancellation, and that freed up a fair bit of vaccine, which was then, as we opened up the AstraZeneca. So as it's freed up, there are other people looking for that vaccine. And we expect now that as we're opening up from the 55 to 59-year-olds, some of them may then choose to cancel their AstraZeneca appointment and then switch to mRNA. But the uptake of AstraZeneca appointments has been very strong. As we went with the initial opening up to the 40-plus-year-olds, I think there was about 10,000 appointments that were quickly booked up. So, there will be some fluidity, but I fully anticipate that the demand for AstraZeneca will very quickly take any spots that open up as people shift to getting an mRNA vaccine.
Go ahead with your follow-up, Victoria.
Thanks. And this question is for the Premier, and I'm going back to some of your comments at the beginning, targeting, I guess, or telling young people, some pretty serious things. Do you have evidence that it is mostly younger people and not older groups doing these activities? How do you know it's young people, and what's your stance on, shaming them versus trying to educate them a little nicer?
Well, I don't know how I can be nice when they're putting lives in danger, but I am trying to educate them as well. I did say just to look across the country at different provinces that are experiencing the third wave. These are the same variants. So that's an education, I think, to all of us that the third wave is very different than the other waves. With these variants that we have in our province now, they spread quicker, and the evidence is there that the age of 20 and 30 and 40-year-olds are going into the intensive care unit. That should be a wake-up call to all of us. And yes, I'm getting impatient because it's frustrating for me. Most Nova Scotians are doing the work they need to do, and I appreciate that, and I want to thank them for doing that. But we need to make sure that we have our eye on the ball here, and I have faith in Nova Scotians when they know the seriousness of the situation and they know that they're putting the loved ones at risk, that they'll start to comply. So that's my plea to them today.
Next question will go to Chelsea Gould with Saltwire.
Hello, Dr. Strang. I'm hearing a rumor that doctors won't be able to practice unless they get the COVID vaccine. Is the province making the COVID vaccine mandatory for all healthcare professionals?
No, we're not making the vaccine mandatory for anybody, including healthcare workers, and that's consistent. Nobody across the country is looking at mandatory vaccination.
Go ahead with your follow-up, Chelsea.
Okay, thank you. Premier, some small businesses are feeling a little sidelined with larger retailers still able to sell their non-essential goods. Would you consider implementing something like in Ontario where, say, retailers had to rope off non-essential items and only sell essential goods?
So I think it's important that we have those retailers open that have essential goods into their stores, and as long as they're following the gathering, or not the gathering, but the restrictive limits of the people that are allowed in their stores, it doesn't present an elevated risk, and so we need to continue to make sure we're looking at what the actual risk levels are that are presented. I recognize that retailers that are closed are facing huge challenges right now, and all I can say is that we'll support them. We'll have more to say on that tomorrow on how we're going to financially be able to support them through this time, and we all hope it's going to be a short period of time that we're shut down, and I think the more that people listen to these restrictions, the sooner we'll be able to get open back up.
I'm going to add to that. Surely in the discussion on the restrictions, my colleagues in the Department of Business, in their communication with other provinces that tried to do this and limit what items could be sold in a store once it opened, was very chaotic and very problematic, and actually didn't work very well at all.
Next question will go to Preston Mulligan with CBC.
Hi, yeah, thanks. Question for Dr. Strang. I think we're hearing from people who are in their 70s who got their first shot of Pfizer and Moderna, wondering why they have to wait for many more weeks for their second shot, even while those in the 50 to 64 range can book now. Can you talk about that?
So, and people who when they booked their appointment had a 3 or a 4 week period when they booked their appointment, they were allowed to then get their second dose at that time. Once we opened up with the 4-month interval, people booked their appointment in the clear knowledge that it would be 4 months before they were able to get their second dose. We know that both the MR, all of the vaccines really provide good immunity from a single dose, and our focus is to get, before we start offering second dose to people, our immediate focus has to be that we get as many Nova Scotians as possible their first dose of vaccine. That is the immediate and short-term population immunity we have to achieve, and that will protect everybody, even those who for some reason cannot get a vaccine or have a lower response to the vaccine than others. They are protected by having everybody else around them vaccinated as well. Once we achieve that, then we can build longer-term and enhanced immunity by then getting everybody the second dose.
Go ahead with your follow-up, Preston. Preston, are you still there?
Sorry. Another one for Dr. Strang. Do you see a scenario, even as you said our numbers are going to start going down, but even if our numbers remain in the triple digits, do you see a scenario where schools might possibly open next week or the week after?
I certainly don't see schools opening in the next week or the week after. We'll continue to look at our epidemiology and see what progress we're making and when it might be reasonable to open schools. Certainly getting kids back in school learning has been one of our priorities throughout the whole pandemic, and it will be a priority as we start to look at when we can reopen things. But it can only be done when we're in a position where we have low risk in communities, which then create safe schools.
Next question will go to Pat Healy with the Laker.
Hi, this question is for Dr. Strang. On Friday night, a letter and email went home to parents and guardians at HRH about a case-connected COVID case. And then it said that testing for all students and staff. A couple hours later, the letter, corrected notice went home saying only the close contacts. What led to that change?
So there was some miscommunication from public health with us and working with the school administration. When we identify when we work in a school, it's the identified close contacts that we recommend for testing. The other ones just are not necessarily recommended. It's not that we recommend testing, but like everybody else in the province, we're saying you should consider getting asymptomatic testing. So there was just a bit of miscommunication there, unfortunately.
Go ahead with your follow-up, Pat.
This next question for Premier Rankin and Dr. Strang. with how many gathering limits gatherings there was this weekend over the limit, how disheartening is it to see that?
Well, I think, thanks, Pat. I think you saw how disheartening it is for me, and I do still have faith, though, that Nova Scotians, when they understand the seriousness of the issue, that they will act accordingly. This is a select few people, hopefully, that are going to start getting the message more and more. We just have to start thinking about our loved ones a bit more, and hopefully we'll see some better compliance in the days and weeks ahead.
And that's all the time that we have today for questions. Go ahead, Premier.
Thank you. Like Dr. Strang, I am worried about the number of patients infected with COVID in our hospitals. 42 people who cannot manage their health at home, and now 8 in the ICU. Today I've spoken with Dr. Ward Patrick, Head of Critical Care at our Health Authority, where everyone is working hard to manage the increase in hospitalizations at the QE2. He's worried too. Doctors and nurses have told us this third wave is different. Younger people who are otherwise very healthy are being admitted this time, and they are much sicker than the first wave. Imagine not having the energy to walk and talk. Imagine not being able to get out of the bed or lift your head off the pillow. Imagine not being able to breathe on your own without a ventilator. Now stop imagining. This is what some patients infected by the variants are experiencing at this very moment, and they are now fighting hard in the hospital. I'm worried about them and their families. We wish all of our current patients a full recovery, but it is a reminder that the variants do not discriminate, and we need to be careful, and we need to protect each other. Today is the last day for the MLA for Annapolis. So to my former boss, friend, and mentor, former Premier Stephen McNeil, I want to thank him for helping protect all of us in the first and second wave. And of course, my best wishes go out to him and his family, his wife Andrea, and Colleen and Jeffrey. Remember today how he reminded all of us to work together, to be kind to one another, and to follow public health protocols. And when enough people ignored them and continued to gather and socialize, remember what he told us. Stay the blazes home.
I also say to Premier McNeil, thank you, sir, for your service to this province. It's been a privilege to work beside you.